evening, everybody, and welcome to the To Be Told podcast. My name is Erica, and this is Brandy.
Hey guys.
Hey, so um, as you all know, if you don't know, our podcast is all about dental care. Dental care, particularly for the underserved and underprivileged, particularly people of the brown and black persuasion. So, um, but anybody can, tune in because, not just people of color need help with their dental care. So, yeah,
Mhm.
we have been doing a restorative care series.
Mhm.
So, we are going to do implants today. So exciting, right? Yes.
I guess.
I mean, yeah.
Listen, if you're
So,
in the market for one, then it's exciting to
yeah,
find out what's
yeah.
going on.
Right, exactly. So it's so much information, you guys. It's going to be a two-parter. Okay, so definitely tune in for this week, and then next week for
Mhm.
our the second episode of this for the series of implants.
Yeah.
All right. So first question, I'm sure everybody wants to know, what is an implant?
Okay, so an implant is placed during a surgical procedure, and it's a procedure that replaces the roots of a tooth that has been missing or a damaged tooth with metal screw-like post. And the function is to be like a normal root. So the metal post will function as a natural tooth root. And then there will be an artificial tooth placed on top of that metal post that's taking place of an old tooth root. And that artificial tooth could either be a crown or it can be supporting a denture. But once it's placed on the implant, it will function very much like a natural tooth.
All right. So next, why is it done?
Okay, so typically implants are done for patients who have one or more missing teeth. So if you're missing some teeth, or if you're missing all your teeth, implants can be used to help restore teeth and replace them. Um, but you have to have adequate jawbone, so you have to be like of a certain age. You can't be like a teenager getting it because sometimes teenagers are still growing, and the jawbone has to be fully formed. Um,
Now, quick
also,
question, not to
mhm.
interrupt. Sorry. When is it fully formed? Your jawbone.
Well, it depends. Typically, usually like in the late teens, so like anytime after, I don't know, like 18, 19. But it really depends on each patient.
Okay.
And that's something they'll know when they take special x-rays, like they'll be able to tell those things.
Okay.
But typically if you're like over 18, by then, the bone growth should be mature.
Okay.
Um, and you also have to have adequate bone to secure the implant in place. If not, you may have to have some bone grafting to help build up that bone.
Sorry.
Okay, so that's the bone graft, but you
Okay.
also have to have healthy oral tissue. So your mouth has to be healthy. It has to be free of disease, free of periodontal disease or gingivitis. Like your bone and gums need to be healthy in order for the implant to be placed. And also, you can't have any health conditions that affect bone healing. So, I'll give you one example. Patients who have osteoporosis are typically put on special types of medications, and they're called bisphosphonates. And those bisphosphonates affect the way the bone heals in the jaw, not in the rest of the body. It's so if you're on any medication like that or have any kind of condition that will have anything to do with your healing of your bone, then you may not be a candidate for an implant. Um, Implants are also good for people who are unable or who just don't want to wear dentures. So some people are just like, I'm good. I don't want to take stuff in and out of my mouth. I want to have something fixed. But somebody who may not be able to wear implants might be somebody who has a very strong gag reflex or somebody who has very large bone growth inside their mouth called torus or tori. So those people sometimes are not candidates, they just can't fit dentures. Um, if you
Okay.
have tori or torus, sometimes they can be removed or smoothed out, and sometimes they can't. So You want to make sure you're able to wear a denture if you're wanting to support it with implants.
Okay.
Also, if someone wants to improve their speech, so people who don't have teeth or are wearing dentures might have ill fitting dentures and talk funny or sound funny.
Like a speech impediment.
Yeah, if you put something in your mouth that don't fit and just see, even if you put retainers in and they fit weird, like you know what I mean. Like I wear retainers when I go to
Yeah.
sleep, and whenever I'm on the phone with Christian, he's like, "You got your retainers in, don't you?" Yeah, you could tell because
Yep,
it
that's
inhibits your
funny.
speech.
Yeah, because my aunt has them, and I'm like, you got what's in your mouth? Like, what's wrong?
You could tell that somebody has
But
some
she don't even
in their
wear it.
mouth.
She wears it like during the day. I'm like, what's wrong? What's going on?
Oh, does she? She might still be in that stage, but I
I'm
mean,
like,
it's
what's
been
happening?
like 20 years since I had my braces off. But I still wear them like a few times a week at night. But he can always tell. But it's the same thing if you have dentures that don't fit
Mhm,
well. Like, so this will improve your speech. It'll improve the way you digest food as well.
mhm,
And also, just say you're not wearing dentures, but you have a bunch of like loose teeth or missing teeth. Even speaking through a bunch of missing teeth inhibits your speech. So, getting the implants, if you want to improve your speech, um, you also cannot smoke. You cannot be a smoker. You can't be a smoker of any kind. That's weed, that's cigarettes, that's cigars, that's hookah, and whatever it is the little young tenders be doing now with what they call it. I don't know, but
the
you
hook,
can't be
oh,
smoking.
the vapes and
Yeah,
vapes and vapes and hookah is the number one
look, can't be doing none of that.
millennial millennial Gen Z type
Yes.
stuff.
I couldn't remember what it was called because I'm so far removed from those things. But I mean, no smoking of any kind. And you have to commit to the process. It is many months, up to a year, before it is complete and done. And I'll go into that into detail.
So go ahead. What are the risks? It's go ahead. I'm like, go ahead. Like,
It's a lot. It's more to it, Erica, than just going to the dentist and saying, "Oh, I want to get an implant." Like it's a
yeah.
lot to it. So that's the whole point of going over it. So is it fun to talk about? Maybe not necessarily, but it's necessary.
To talk
You know what I'm
about is shoot.
saying?
It ain't fun to
Is
talk about what
listen,
to do.
it's necessary to know these steps because
Yeah.
you with knowledge comes responsibility, and once you
Hmm.
know, you can make informed decisions once you have an
Yes.
idea. So that's the whole point.
Absolutely.
So, all right, so the risk. So with any surgery, that you have, dental implant surgery poses some health risks. So the problems are very rare, to be quite honest. And when they do occur, they're usually minor, they're usually easy to treat. And some of the risks include infection. So you can have infection at the site where the implant's placed. You can have injury or damage to the surrounding structures or other teeth or to blood vessels. There can be nerve damage, which can cause tooth pain, numbness or tingling in the natural teeth, in the gums, the lips, the chin, the tongue. And you can have sinus issues when we're working on the top teeth. So, dental implants are placed in the upper jaw, they protrude into one of your sinus cavities. So, a lot of times, the doctor will take a special x ray to make sure your sinuses are in a safe place to place the implants. If you have
Who would
low
have
sinuses, I'm sorry.
This is so crazy. I'm talking out loud. Sorry.
Oh, okay.
Again, I don't mean to interrupt, but like you would never even think about your sinuses in regards to your teeth. But I mean, normal lay people like myself who don't know
Yeah.
about these things. I'm just like,
Yeah, you
what?
wouldn't normally think that, but that's why I said there's a
Yeah.
ton of things to
Hmm.
consider. And so
Right.
your doctor hopefully, is well versed and knows what they're doing because they will take all of these pictures and stuff just so
Hmm.
you know. So typically you'll have either an oral surgeon who does these or a periodontist. So the oral surgeon does surgeries, the periodontist is a gum specialist. You may have some general dentists who have taken other classes to do it. Um,
Hmm.
I suggest going to somebody who this is all they do. That's
Yeah.
it. Because the more you do something, you're expert at it. So, but anyway, yeah, the sinus problems they will address those in a consultation, and take a look. If there's any sinus issues, they may suggest doing a sinus lift, or they may say you're not a candidate. So that's that. And then,
Okay.
but those are some of the risks.
What to expect? Yeah.
All right, so the dental surgery is the outpatient surgery, and it's performed in stages. So each stage has healing time in between the procedure. The process of placing the implant includes multiple steps. So, the first step is if you have a tooth that needs to be removed, that tooth has to be removed. Sometimes
Mhm.
you're already coming in like, oh, I'm missing a tooth, I want to replace it. But for folks who have the tooth, the damaged tooth is removed. Then we prepare the jawbone if you need to with the bone grafting. You may not need the bone grafting. And then you have the implant placement. You're going to have the bone growth with the implant and the healing. Then we're going to place the abutment, which is like a cap that goes on top of the implant,
Mhm.
and then the artificial tooth.
Okay.
So those are the steps quickly. And then, of course, I'll wind up breaking up the steps. Any questions, Erica?
No. No, none right now. Yeah, but you know what? How long does this take to heal?
So, well, the entire process can take many months from start to finish. So much of the time is devoted to healing, um, because you have to wait for bone to integrate with the implant. So I'm going to give you an example. If you were going to place like, Erica, did you used to have in your backyard? Did you have a little backgammon or badminton? You
No.
didn't have one of those in your backyard? For some
No,
reason, I felt like,
we probably had like for like a cookout or something like
yeah, that's what I
a
mean. Like,
net,
I think
like
I remember
yeah,
us putting the net up and playing. Well, anyway, so my
probably
point for
whatever.
bringing that up is
Okay.
because, when you're placing one of those, like you're putting the stakes in the ground,
Mhm.
like if you just put the stake in the ground, say you make a hole, you put the stake in the ground, and you just leave it there, right?
Mhm.
And you attach the net, it'll kind of be like wiggly. The
Mhm.
only thing that's going to keep it from wiggling is stuffing dirt down in there, like
Mhm.
around that thing, so that make it solid. So that's kind of how the implant screw fuses with the bone. You can't use it right away because it's almost like it's in the space, but it's not stable. The bone
I get
has to
what you
fuse
mean.
to it.
Like my dad put a new mailbox in for me. I got a new post because I had like a thin one and I didn't like it, and I wanted a larger one. So he had to take the
Mm-hmm.
post sticker, put it in the
Yeah.
hole, dig
Mm-hmm.
that dirt out, put the pole in there, do whatever else he had to do, and then he put cement in there.
Mm-hmm. Yeah. So that's
Same
it.
thing, right?
Yeah.
Okay.
You got to fill it in. It's the
Yeah.
same exact thing. So the bone has to fill in. Now imagine having an implant placed and then trying to chew on it the next day.
Oh.
Is no
Oh
way you
God.
could do that because the biting forces are so strong, it would never survive. Like, you would lose the implant. So
Ooh.
that's why it can take so many months. So typically, when I
Mhm.
was long many moons ago working at the oral surgeon's office, and we used to do these procedures, he would make them wait 6 months before they came back to place after the bone grafting. So bone grafting place first, 6 months after implant place, 6 months after tooth put on top. So like a whole year process,
Oh.
especially for molar teeth because you gotta use them to chew. So it can take up to a year. Sometimes, just so you understand, there's several types of bone grafting materials that we can use to rebuild the jawbone. Some options are natural bone. So that can be bone taken from another location on your body, and some of it is like a bone substitute material, and some is bone from other sources like cadaver bone. But
I knew that was coming.
I will say that's rarely used, but I mean, I've seen it used before.
Okay.
um, and then, like we were saying, is that it can take several months for that bone to heal. Some people need minor bone grafting, so just very little, and it doesn't take as long, but it just depends on the condition of your jawbone, how we proceed. But that's done prior to placing the implant.
All right. So I gave you guys all of our information. So check us out next episode for the
Alrighty.
rest of implants. So
All right. We'll see you
exciting.
next
Okay.
time.
All right. Bye, guys.
All right. Bye.